Let's start, I think, at the other end. Michael, too? Mm-hmm. Yeah, Everyplace. Tell us more.
Thanks, Stefano. So I'm Michael Tu. I'm the founder and CEO of Everyplace Labs. We're developing a self-service kiosk for diagnostic testing at essential work sites. So our kiosk is deployed in essential work sites like manufacturing plants and warehouses, and it automates the point-of-care testing process and also the processes that surround on-site testing operations, including dispensing testing kits to employees. There's a vending mechanism inside. It self-sanitizes the testing surfaces in between patient usage automatically, and it converts regulated medical waste into normal municipal waste. So it's a very turnkey solution that human resource leaders don't need to manage on a day-to-day basis, and it allows essential workers to get results while they're at work within 15 minutes.
Bold option, bold solution. Love it.
Thank you.
Marina, it's a pleasure to see you again, first of all.
Pleasure
so
to
welcome
see you.
to the stage here at StartUpHealth Festival. Please tell us about your moonshot and a little bit about the space you're working in.
Sure. So I am Marina Borukhovich. I'm the CEO and founder of YourCoach Health. And we are building a new category. We're creating a new category. We're building an operating system for behavior change powered by health coaches. We have a gig economy of health coaches that is practicing on our platform, and we give them digital tools to make their great work even better. And we match them with our clients who are companies who are looking for health coaches for their clients, members, and their talent. And these are companies from digital therapy companies and digital health companies and patient support programs and clinical trials who are looking to surround their offering with health coaches.
I think the way you approach this really is unique. I'll stay for a second here because you didn't go out and build an entire company, hired a bunch of coaches and the platform, et cetera. You actually create a platform for them to use to leverage their existing tools, their existing knowledge base, but also existing patients. And at the same time, you're also providing them other avenues of care. So it's a twist on a theme, which I think is really clever. So well done on that.
Thank you. Yeah, so we give them a platform to do everything that they need to do. But what the coaches are not maybe great at is marketing themselves and creating jobs for themselves, and that's what we're there for. And the great thing about having the platform is because we can identify what they're really great at, what individual approach they bring. So when we match them with a client, it's a sticky situation. It's not a cold call where they maybe go with each other, they may not. It's a real relationship, and they start working together.
Excellent.
So I'm really excited about that.
Okay. Vitor.
Thank you. Hi, I'm Andrew Rosenberg with Responsum Health. Our moonshot is to improve the knowledge of patients or of individuals with chronic conditions, to empower them to make better decisions, and to give them a set of resources and community to enable them to better achieve their goals. We do this, I guess our big innovation is that we create disease-specific apps. Our 6th one is coming out next week that essentially perform a Google search for like a doctor Google search. We've all been through that and can kind of relate to that. But it's with a team of writers and editors using technology and in partnership with patient advocacy groups to make sure that the news feed that patients get of summarized content is validated and understandable and engaging. And so as a result, we're able to really pull these patients in around, and individuals I should say, because they don't always think of themselves as patients, around into these communities, around these apps. And from these communities, needless to say, we're able to learn an awful lot from them as well, through surveys, through passively monitoring their activity, their searches online. And so the beauty of what we're trying to accomplish here is we're both empowering patients, but we're also helping patients to empower us as researchers and entities that are looking to set research agendas and understand better what's the lived experience of people with a given chronic condition.
The lived experience or the challenges of finding their information?
The lived experience, I'm sorry?
Because you're doing research on it, so which is the piece of it that you're looking at?
So we will survey patients, we will be watching the things that they search for in our moderated community chats, the questions that they're asking, the symptoms that they're challenged with, the comorbidities that they have, and we're able to sort of learn an awful lot from them. This is stuff, when new drugs are under development, for example, it's in a very, kind of a very clean setting, it's in a lab setting. People don't really understand very well what happens in the real world. And the only way that you can understand that is by communicating, engaging, building relationships with patients, and learning from them. And that's what we do with our communities.
Outstanding. Vitor, Sami, been following from afar. Really interesting. Tell us about your moonshot and what you're doing.
Thank you. My name is Vitor. I'm a physician by training, founder and president of Sami. We are a health insurance company in Brazil. Our moonshot is healthcare affordability. 50% of people in the world doesn't have access to quality healthcare services. In Brazil, 80% of people don't have access to private health insurance. And we're trying to change that. I mean, as Jonathan Bush was saying here, healthcare is very inefficient. We all know that. But the thing is, there's a cost. For every inefficiency, there is a $10 plus that someone is paying for like employer-sponsored plans or individual plans, and if it's $10 more costly, someone else won't have access to that because they can't pay. So we're really changing that. 75% of our members didn't have a plan before, so it's awesome. I was talking to one of our customers, Lucas, the other day. He's 24 years old. His first time he has health insurance in his life. It's Sami's, so it's awesome.
So one thing I wasn't clear about, and I think it's worth mentioning, it's still a B2B model. You don't go direct to consumer, right?
Yeah, we all know like this future of work thing, like gig economy thing. People are getting incorporated as a company. When you think of like a hairdresser or bakery or Uber drivers or freelance designers or developers, consultants, a lot of independent consultants. So we are sell to B2B, but very small B2B. Very small entrepreneurs, the people that are working to make their wages, their living. So we don't sell individual plans. We sell to this gig economy. In Brazil, there are at least 12 million people incorporated as a company. I believe it's part of this trend, and maybe going to be even more common now with remote work. So we're focused on this population, and now going up to small groups. So it means SMBs up to 200 lives per company.
So thank you for that explanation. And I'm going to go back to Marina real quick. So if I'm a potential partner and I come to you, what are you looking for in me as a partner? Or if you want to take it to the investor side as an investor, I'll leave it up to you.
I can take it to both, actually.
Sure, great.
Yeah, so with a partner, what we're looking for is an understanding what a health coach truly is. Because a lot of companies and everybody these days wants to surround their offering with health coaching, which, it's a buzzword right now. But a lot of people don't really understand what health coaching is. So it's not a nudger, it's not a cookie cutter approach. It's not somebody to say, use this solution or follow this exact program. It's somebody that works with individuals to help them reach their goals. So the partner.
Stay on that for a second.
Yeah.
What kind of goals are you talking about?
They're health and wellness goals. So
Wellness.
somebody may want to feel better because they're not getting enough sleep, or if somebody's nutrition is not on point, or they have a lot of anxiety levels. So it's non-clinical. It's a non-clinical approach to behavior change. So these are the health and wellness goals. I mean, as startup founders, I think all of us need to change our behaviors, right? Because we're just like running on empty all the time. And actually this year, I decided to practice what we preach and just, take care of, like body, mind, and spirit, right? But so we're looking for, and we do a lot of education to potential partners to talk to them and for them to understand what it is that a health coach truly does.
And a venture person?
For venture, yeah. So, I think as founders, we pretty much all look for the same thing, and we want somebody to be the right partner in our mission. And some investors approach it from a different perspective where they have an idea and they want to put you into that box. Mm-hmm. And it's not really what we're looking for. We want somebody who understands our mission, and advice is great. We're always up for advice and constructive feedback and critical feedback. That's really important. But somebody who understands our mission, which is by 2030, for the 8.5 billion people in the world to have access to health coaches.
Right.
That is our mission.
Vitor, at Sami, same question. You're in this massive growth phase. What is the best partner for you in that environment? Also, because you're in Latin America, but I also want to ask the question, you can take it to the venture side as well, because you're clearly on a strategic growth position. You need strategic partners, you need strategic investors. What are you looking at?
Perfect. We have raised $36 million to date with 4 of the 5 most active VCs in the region. Our investors have done like 14 of the 16 unicorns in Brazil. And we have learned a lot from having so many VC in our cap table. And they're very different. Not all VCs are made equal. So from now on, what we have realized is that being a health insurance, it is a capital intensive business. You have to be raising capital all the time. You have like capital provision needs. You have actuarial risk. So More important, they have the next round or the specific amount of money for or a partner. Having the right partner, it's more important. We have access to a lot of VC playbooks, but we are 500 people now in the company, getting more complex, 10,000 members. Getting the right partners to make decisions, getting the right partners to go through difficult moments. Really have experience from people who have done that in the past, have scaled companies, have worked on large health systems. It's still hard for traditional B2B, B2C, SaaS, marketplace, fintech investor to understand why electronic medical records is relevant for a health system. You have healthcare works as a system, and you have to think of every piece of the system if you're building one from scratch.
So you're looking for an investor who understands the ecosystem and can support you in your daily decision-making process as a company that's growing quickly. That makes a ton of sense. Okay, you may have seen from before, I have a magic wand, and I want to wave it and give it to the last two of you guys. So we'll start with Andrew. What's the world look like if 20 years from now, you guys, it's Hogwarts approved, I promise. You can wave it, and we're 20 years from now, 2022, 2042, and what's the world look like?
With our moonshot.
No, with you guys.
With us, if we're successful.
Yes.
Then in 2042, there will be a Responsum Health app for every chronic condition, meaning that when people get diagnosed with a new condition, rather than doing what their doctor says not to do, which they all go online anyway. Everybody goes online and looks.
Yes, I know.
But we're all familiar, we all understand the threats and the risks of going online for your information, especially about something as vital, as potentially controversial, even as easily misled as your healthcare. So that my dream would be that in 2042, when you get diagnosed, your doctor says, I'm not going to tell you not to go online. Instead, I'm going to tell you to go online in this curated environment, to download a Responsum Health app for your condition. There are professionals there that are working hand in glove with trusted patient advisors and patient groups to make sure that they're curating the web for everything, for content, for new discoveries, for patient stories, for videos, and they're providing it to you in an easy-to-use format, easy to read, easy to understand, and that it's going to make a difference in your life because you'll become better knowledgeable, better empowered, you'll make better decisions, and a patient that makes better decisions is a patient that drives better outcomes.
I love it. Yeah, and we'll probably do this all in virtual reality, right?
Yeah.
And they're working with health coaches too, right?
And of course, the coaches.
Yeah.
And of
Just
course, I
making
should have
sure.
mentioned that.
So in 2042, we
That's
imagine...
a wand, it's not a
Yes,
microphone.
all right.
Yeah.
So in 2042, we imagine our kiosks being deployed in communities wherever patients live, work, and play. So this will be your essential work sites like warehouses and manufacturing plants throughout the world, and retail locations like retail pharmacies, maybe in your CVS or Walgreens or in a Home Depot store as an example. And this allows underserved patient populations, essential workers, and people experiencing homelessness to have very easy access to diagnostics that are both affordable and very reliable.
Outstanding. Hold on to that wand, because I have a question for you. Creating a portable smart lab is challenging under any situation. I've actually looked at the restaurant space once. Point of care solutions are tough. What have you learned as an entrepreneur about that specific space?
So what we learned is to really focus on our customer needs and user needs rather than focus on what our competition is doing. So after the pandemic hit, there was a big rush to decentralize diagnostics. So there's a lot of competitors from small startups to very large corporations playing in the space. And there's a lot of copycat players who, a lot of people are trying to develop the next at-home tests or another test strip or another assay. But we decided to take a different approach, and we did a deep dive with human resource leaders from essential employers to really understand their need for a turnkey solution that is automated and low cost. And because of this, I believe we've developed more of a sustainable competitive advantage long-term where we can uniquely serve our customer needs better than other players can.
Awesome, thank you.
That's
Sure, actually, that will come back to me. No, Marina, yeah. So Marina, we'll go to you now. Thanks. So you actually built an app that allows 2,000 workers to traditionally work online, and then all of a sudden the pandemic hits. And for some, it was a huge challenge. As we heard earlier, it went from 50 million revenue to zero overnight. For other people, it's actually become an opportunity. What did you learn as an entrepreneur about taking a challenge like that and turning it into an opportunity?
To think fast. So we built our platform. It was mobile first because everybody was always on a move, and that's what we went to market with. And then the pandemic hits, and we realized that we need to build a web version right away. So we put all our resources and we created a web version because now everybody is in front of their computers. So, which actually, that was always in our plans, but we needed to do that a lot faster. And then, I feel a little strange saying this, but for our business, actually the pandemic, it enhanced the value of health coaches. It enhanced the value of what we do. And people started realizing more about preventative health and how they need to start taking care. It's not when something goes wrong, it's you need to take care of it before it does, right? And people don't realize how bad they feel until they start feeling better. Right. And the value of what we do is, it's a lot more visible now. So it was twofold, but lots of lessons learned.
Fantastic. Yeah. Andrew, I have a question for you.
Yeah, hit me.
So I love the fact that you created these apps that are specifically disease-focused, and the technology behind them is really clever and thoughtful.
Thank you.
And the ability to collect the data from them is really powerful, so kudos on that.
Thank you.
For anybody who's creating content, you have limited resources. How do you choose? What have you learned about choosing your next, you just did long COVID.
Yeah.
That was a little bit obvious, but
Yeah.
what's next and why is it next? And
Well,
how do you select amongst all the possible opportunities?
Well, so right now we're kind of in a phase of our company where we're just kind of scaling, but we've been opportunistic about what we're entering into. Next week, we'll be launching our 6th app for women with menopause. And the reason is because it was part of a grant from, an independent grant from a pharmaceutical company that has an interest in supporting education in the area of menopause. So similar with our app in chronic kidney disease, for example, in glaucoma, these are all areas where, and uterine fibroids, where there's been a commercial supporter. And that's, if you were to ask me the question that you asked these guys, what's the perfect partner? It would be either a company or a nonprofit that has an interest in supporting a given community of patients, as well as learning from them. So that oftentimes will be a pharmaceutical company, but it doesn't have to be. It could be a medical device, it could be a nonprofit that has an interest in supporting the education, empowerment, better decision-making of a given community of patients.
Terrific answer, actually. I really like that. Thank you. I want to give you 2 seconds, 45 seconds. We'll go over a bit. I want to hear more about Sami, because one of the things you guys did that was so interesting was that you went and studied all the existing companies in that space in the United States. That's an North American market. Then you translated it to Latin America. Give us one lesson learned about translating an American model or a North American model to a Central American model, or I should say a Latin American model.
Perfect. Something I was certain when we were discussing what to do as a startup, healthcare is hard. Healthcare is hard. Health insurance is probably even harder because you have HR risk, you have lawsuits, you have chronic disease management, you have accidents, you have cancer. Healthcare is hard everywhere. And no one can claim that they have solved healthcare issue, not in the US, not in UK, not in Asia. So what we tried to learn was how can we become the more efficient? What is the best model? If I try to pick the best thing in every place, and something we learned about the mandatory gatekeeper. As sometimes people avoid it, that, you have to go to family physician first, there is like a barrier, I want to pick my doctors, etc. But again, healthcare is very unaffordable. So if you want to make something affordable, you have to put rules. You have to be strict about your model. You have to create a care path in ways, use data and use algorithms to create a path. So when we decided to go similar to Kaiser Permanente in California or similar to NHS and different from a lot of digital solutions that are optional or concierge or co-pay related, that no, it's mandatory. And it makes a huge difference. When you look at our apps, for example, 98% of our members download the app. It's because the app is awesome, not because it's mandatory. Because if you have to go to a family physician and it's mandatory and you talk to your family physician through the app, you have to download the app.
So to summarize that, your take home was in order to limit cost, you have to limit choice.
Yeah.
Thank you very much. And with that, I'm going to wave my wand and bring us back to 2022 and our next part of Startup Festival. So thank you very much for joining us, and thanks for being here.